Good afternoon. Thank you for joining us for an update on the IT outage impacts to our health-related systems. Along with Minister Haggie, I want to welcome Mr. Dave Diamond, President and CEO of Eastern Health, and Pat Hepditch, Vice President of Solutions and Infrastructure with the Newfoundland and Labrador Centre for Health Information. I think it's safe to say that the cyberattack is extremely troubling. We know cybersecurity is incredibly important in 2021, and it's something that this government has taken seriously, and something, frankly, that we all need to continuously remind ourselves about in our own personal lives. Unfortunately, the reality of a digital age is it's becoming all too common. Ireland, Saskatchewan, thousands of local governments across North America, and even as we all saw last year, the Colonial Pipeline in the United States. They've all experienced debilitating attacks. And just as we are, they trusted the experts to move forward. I can't stress how important it is for us to continue to do that here in Newfoundland and Labrador in the interest of all of our security. I've spoken with the Prime Minister, who expressed his concern and support. I've also spoke with several cabinet members, including our own, and with Minister LeBlanc, who is Minister responsible for intergovernmental affairs. I've been chatting with him regularly, and he's offered the full depth and breadth of federal support. We all have questions, and I know, believe me, I know, everyone wants answers. And our government is being as transparent as possible during this troubling time. We are exclusively focused on keeping you informed in a way that continues to keep us all safe and not to further inflame the situation. I'm not willing for political points to put the province further at risk. While attending the historic United Nations Climate Change Conference this week, I had the opportunity to engage in important discussions with business and political leaders, the President of the General Assembly of the United Nations, and take in eye-opening sessions like one on oceans, so crucial for Newfoundland and Labrador, with U.S. Special Envoy on Climate Change, John Kerry. Let me assure you, while participating in those critical conversations on combating climate change, growing our green economy, and further developing clean energy, I remained focused on this issue. The most distressing part of the entire situation is the impact that is being felt by many Newfoundlanders and Labradorians, our families, our friends, and colleagues, the ones for whom access has been disrupted, treatments have been disrupted, and the failures at the healthcare system have put strain on an already strained healthcare professionals. Whether it's cancer treatments or some other healthcare service, let me be clear. An interruption in that care because of an attack on our systems is frankly unacceptable. Like so often before, whether through COVID-19 or Snowmageddon, you, our province's healthcare professionals, have continuously put the best interest and the healthcare needs of the residents of our province first. Thank you. Thank you for rising to the challenge again and again and again. I know you were tired. I have heard firsthand your frustrations, and I know sometimes you may feel like giving up. But I also know that those words don't exist deep down in your vocabulary. You are always here for the patients of our province, who you selflessly serve. While you have been dubbed heroes before, I think that is unfair. Superheroes is more applicable for the tasks that you have been asked to perform and continue to perform despite challenging times. My friends in the healthcare professionals alike, historic times call for historic efforts. And despite the fatigue and in the face of adversity and staring down new challenges, you are all doing extremely heavy lifting, for which the entire province is eternally grateful. I want to address the many Newfoundlanders and Labradorians who have had their healthcare needs interrupted over the course of this past week. To manage this outage, we have activated our Provincial Emergency Operations Centre, and the regional health authorities have done the same. Please be assured that we are all united in our efforts to resolve this matter. Everyone, from the health and community service staff to Newfoundland and Labrador Centre for Health Information, along with Bell, our managed service provider, are working collaboratively around the clock to get the system up and running. We ask for your continued patience as this important work continues with the advice from world-class experts. I know it won't be easy. It won't be certain. But as with COVID-19, together, my friends, we will get through it. And while it may be hard to see at times, hope and brighter days lay ahead. Thank you. I'll now turn it over to Dr. Haggie for some brief comments.
Thank you, Premier. Again, I would like to echo the thanks to Mr. Hepditch's shop, to the regional health authorities, my own staff who have been working round the clock too. We're in day 7 of what is an unprecedented situation. And as the various parties all work together in a way that I'm really impressed with, we're doing it in a stepwise way to ensure that at the end of the day, we don't go backwards with our remediation and we continue to move forwards, albeit slowly. It will take time, and that time span is likely to be days. Fortunately, in some respects, we have the weekend, although that will not be a weekend for a lot of people in healthcare or in IT and the departments. Whilst Mr. Diamond will speak to the impacts on Eastern Health and the provincial programs that they run, I'm going to give an update on the service levels in other regional health authorities to help others. So starting with Central Health, we're proceeding here with only those services that are not impacted directly by IT. We have in-person dialysis at both James Payton and Central Newfoundland Regional Health Centre, which are proceeding. For cardiopulmonary and rehab, there's a number on your appointment letter, and you should call that. Mental health and addiction services and counselling are going ahead relatively uninterrupted, as are all the flu and COVID vaccination clinics. Orthopedic outpatients, you should again call the number on your appointment letter. Midwifery care for those mums expecting continues. There are a number of other services that, however, have been cancelled at the moment until we can restore further modules across the system. So all booked appointments for blood collection and medical imaging, x-rays, they'll be rescheduled. All endoscopy, like tests, they're postponed as well, and the patients have been notified directly. Those that are urgent will more than likely go ahead with an earlier appointment. All orthopedic outpatients in Central Newfoundland Regional Health Centre are cancelled. Mammography exams and breast screening clinic at Roe Avenue are postponed. Family practitioner and nurse practitioner services, however, are working across the region. In Western Health's Meditech system, the main core, which manages patient information, is not operational, and we're going to restore those services gradually. So Western Health will maintain its current level of services into Monday and Tuesday of next week. So only urgent appointments will proceed for surgery, endoscopy, blood collection, medical imaging, x-rays, outpatient EKGs, fracture clinics. The blood collection for INR will continue. A number of services will not be proceeding, so that's orthopedic central intake, pre-admission, pain clinic, pap smears, as they require either blood collection or medical imaging or laboratory support to do their work. Chemo appointments at St Thomas, Roddick and Charles Legros will, however, continue. Those at Western Memorial are now proceeding, albeit at a reduced capacity, and you will have been notified. If your appointment in those areas is going ahead, you will be called directly. Please, however, you may see these appear on your phone as unknown numbers, so I would urge you to answer them. From the point of view of Labrador Grenfell Health, primary healthcare clinics, chemo, regularly scheduled surgical procedures, chronic disease management, flu, COVID vaccine clinics, ambulatory care, mental health and addictions, and all emergency services are not impacted and continue to be available. Routine lab, so blood collection and blood work, routine x-rays, ultrasound, mammogram, those kind of things, up to and including Tuesday, November the 9th, will be cancelled and rescheduled at a later date. Patients will be contacted directly regarding other effective programs such as Well Women clinics, endoscopy at Charles Curtis, and telehealth visits for cancer consultations with Eastern Health. In all regions, the online portal for COVID-19 test results are not available. If your result is positive, you will get a call. If 72 hours have passed since the time of your last test and you're not having any symptoms and you haven't heard, you can assume your test is negative for the time being. Individuals requiring a COVID-19 test are still encouraged to call 811. So in the background, things are happening. There's a lot of people doing a lot of work, and it's a steady climb up a big hill. So again, closing out, I'd like to thank the people, the patients of this province, for being patient as we work our way through this process. We regret any inconvenience. We sympathize and empathize with you. If your condition is urgent, then contact either your primary health care provider, 811, or 911. So I'm going to turn it over now to Mr. Diamond, who will speak specifically to the issues in Eastern Health. Dave?
Thank you very much, Minister. My update will be one that you've heard before. I think it's not a lot of change since we spoke last. It's obviously been a very difficult week for the patients that we serve at Eastern Health. Very difficult week for the clinicians, the nurses and doctors, and support staff, allied health professionals who care for people every day in our organization. And not being able to do that in the normal way and having to cancel has been very difficult. And so I want to again say thank you and to our patients, first of all, for your patience as we have worked through this, and also for the amazing resilience of the staff and physicians, people who are associated with patient care in our organization. We have continued through the week and up till now in an urgent and emergent situation. We've been doing procedures that are either emergency procedures or anticipate being on Monday. Although there are some things that we have been able to do. The minister talked about, our systems are slowly returning. We do have some core IT functionality, but it's not everything that we need to open up fully our services. So we will go into early next week in an emergent and urgent category of service delivery as well. There are a couple of things, though, that our direction that has changed slightly internally. We have now been able to start chemotherapy in our cancer program, which has been very important for us. So starting yesterday afternoon and today into next week, we have been able to do chemotherapy services. We have also provided direction to all of our programs that if there are any services that can be provided that don't require information out of systems that are not up and running yet, and that includes laboratory and diagnostic imaging. But if there's anything else that we can do in addition to chemotherapy that doesn't require the information from the systems, then programs are looking at those services as well. The key is as we slowly see our systems return and as we slowly ramp up our services, until further notice, if you're to receive an appointment or receive a service, we'll call you. And so we do have resources in the daytime and into the evening. And so as we are able to find capacity, find workarounds for the lack of data that we have in some program areas, we're asking our clinicians to have appointments booked, but they'll be booked by us. So we'll call you, and as the minister said, you may get a call from Eastern Health or from the other regional health authorities, and we hope you'll be available to take that call. We are, we have staff available to take the calls. We also have staff working through the weekend to continue to plan to ramp up those services as the IT systems ramp up, and we continue to look forward to more modules coming online that can be connected to what we have now as the core and basic Meditech system. So I think, Minister, I'll leave it there and respond to questions, but I think our basic messaging is we're still in urgent and emergent. We're slowly doing more as systems come on. We will contact people as we are able to do more. We know that there are patients still in St. John's who had traveled early in the week. We've talked about that issue all week, and we want to hear from anybody who's incurred additional expenses because you didn't get notice in a timely manner. We want to hear from you. We also know that there are some patients who are still trying to understand where they fit in those priorities, and we do have a 1-800 number. I'll give that out again as well. Anybody who you don't see yourself so far in the messaging, and we have lots of messaging, PSAs are going out on a regular basis, public service announcements. We have information on our Eastern Health website. We're trying to provide information on social media. But if you don't see yourself in any of those, or if you have particular concerns, you can call us at 1-833-777-1276, and somebody will help you try and navigate your individual circumstances. So, Premier, back to you.
Thank you, Mr. Diamond. I'm not sure, Mr. Hepditch, if you wanted to weigh in with a few comments before taking questions.
Thank you, Premier. So, as folks would have heard, our technical teams have been continuing to work with the RHAs throughout the last 6 days to assess and restore our healthcare information systems. Everyone wants that to happen as quickly as possible, but it's equally important that we do it cautiously to ensure that we can restore things in a state that's stable and safe to use. As we continue to bring systems back online, it's going to have to happen in a step-by-step process. Each system has to be carefully reviewed and cleaned to ensure there is no evidence of the attack, and that we're putting, excuse me, and we're putting the system online in a safe and controlled manner, as I said. To do this as safely as possible, there may be times when systems that have come up may have to be taken down again. As this happens, it's possible we may see outages and disruptions to services. We'll continue to keep the public updated as best we can, but this is a very fluid situation, changing sometimes by the hour. From a technical perspective, we've been keeping the RHAs updated on the status of their systems, and they in turn have been working hard to keep the public up to date on our progress. The hundreds of applications involved here will be brought back in a prioritized basis, and we're working closely with the RHAs to identify the right sequence to bring systems online to meet their most urgent patient care needs. For example, it's been made very clear that systems supporting the delivery of care for cancer and chemotherapy treatments are critical right now, and that is a very high priority. Another important point is that we will restore healthcare systems. As we restore healthcare systems, some records may not be fully available. Teams are working with the RHAs to backfill this information. We'll have more information on our progress with that in the days to come. Overall, I would just say that we're working very hard to ensure this process happens as smoothly as possible, but we fully expect there will be bumps in the road. And lastly, I just want to say thank you to our employees who have been working around the clock, and also that we appreciate the patience of the public as we continue to work on the restoration. Thank you.
Well, thank you, Pat. I'll now open it up for questions.
Thank you, Premier. We have 6 media registered for today's availability. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Peter Cowan with CBC. Please go ahead and make your way to the mic.
Mr. Diamond, we now know that sort of that core IT infrastructure has come back online, but it's missing many of the key components. With that key piece in place, how has that changed the workflow at hospitals? And with that back, why aren't we able to start to go beyond just emergency and urgent procedures?
Yeah, great question. So the Meditech system, the core system that's come on is a critical piece of our infrastructure. It allows us to register patients as they come in, which has been important with the volumes that we deal with in all of our regional health authorities. It includes information like nursing notes, for example, some clinical information, historical lab and diagnostic imaging data. So it's very important, and certainly for the physicians and nurses who are working in our facilities and working to care for inpatients in our acute care beds is very important. And so it's really, we're very happy to see this. It helps us with quality and risk management. It's very important. The pieces that are, a couple of the pieces that will be really important to come alongside that will be the lab system. So to be able to report electronically new lab results and new diagnostic imaging results. Those are 2 of the areas that our clinical leadership have told us are really critical to being able to open our system up more broadly than simply urgent and emergent, for many reasons, not the least of which is just volume, trying to manage the thousands of transactions. And so while we have some very good information and is very helpful for the work that we're doing, particularly caring for the inpatients, there are these other pieces that will be important to the data that needs to feed into this system, so that clinicians are able to provide anything other than urgent and emergent care.
And the follow-up to that, Mr. Hepditch, I'm wondering if you can give us an idea. That sounds like it's one of the key pieces that's needed in order to progress. How is the work going on restoring that system, and what sort of timeline are you looking at to be able to get that system back online?
Peter, again, I'm reluctant to give specific timelines. As I said before, things sometimes have been changing by the hour. But I can tell you that, the restoration process for some of the systems that Mr. Diamond is referencing is actively underway right now.
Our next questions are from Ben Clary with NTV. Please go ahead and make your way to the mic.
Thank you. My first question is for Mr. Hepditch, and is there any concern that bringing back more IT services may expose more vulnerabilities within the system?
The process we're following is to scan all systems for any remnants of the attack and to cleanse them, and perhaps depending on what we see, we may need to rebuild a particular system or component again. And we're doing this in a way to absolutely minimize the likelihood of that.
Thank you. And in some cases, maybe patient information has been lost. So how are you contacting people whose appointments or procedures have been canceled? Is there any difficulty in getting in contact with them?
It's probably best for the minister at this point. But again, we're recognizing the sensitivities around the security of these issues as it evolves. But go ahead, Minister.
Thank you, Premier. The issue around that kind of problem is twofold. One is there are paper backups in certain circumstances, so the clinic lists exist outside of the machine. For those clinics that are entirely electronic, then I think the reading of the programs that I did and Mr. Diamond did and are referenced in PSAs is the key. It'll be a process where those individuals will get a push notification from the facility or the department. And in the absence of that, as Mr. Diamond referenced, there is a 1-800 or 1833 catch-all number for each of the RHAs for people who had an appointment who have not been notified in either the PSA that we've read out or called by the department. This will be a kind of rolling process. I would encourage people to try and be patient, but if they're concerned about the clinical urgency, then obviously there's a kind of off-ramp there through either their primary care provider or 811 or the 1-800 number, or if need be, 911.
Thank you.
Our next questions are from Glenn Whiffen with The Telegram. Please go ahead and make your way to the mic.
Hey, everybody. Thank you for taking our questions today. What can you say to assure people that their health information is safe as we rebuild this system?
Well, I think we're listening to the experts around the world. I know that's what, everyone wants a definitive guarantee right now, but we are doing the best we can with the advice provided to ensure that further security isn't jeopardized, frankly, and we're very careful, obviously, in the words and the dialect and dialogue around this situation, and that's intentional, frankly, so that we don't jeopardize further security. Right now, we're, as you've seen here today, the teams are working hard, and the women and men behind them are all working extremely hard to tackle that exact issue that you asked, and we'll provide updates as we go, but for right now, that is top of mind, of course.
The minister described, Mr. Haggie described the process as I think it's a slow climb up a steep hill. How far along are we, like, till we get our systems back to almost normal?
Yeah, not to put words in Minister Haggie's mouth, but it may be a steep climb, but I don't think it's just one climb. I think this is going to be peaks and valleys along the way, and I don't think that any of us could prescribe a definitive timeline, because the only thing that would be wrong with that would be right with that would be it would be wrong. So we can't give definitive timelines. Minister, I don't know if you want to, but also Mr. Hepditch weighed in quite nicely there as systems come up and come down, and I don't think we should comment on specific systems as it could inflame the situation, but it can come up and down, and they're doing so in a sequential, well thought out way, following experts' advice, and as things come up and issues are addressed, they may go down and they may go up again, and this is just going to take some time and patience. Minister, I don't know if you have anything further there.
Our next
Certainly.
question. Sorry.
Sorry, ladies. No, I difficult on the remote end, not to tread on people. I apologise. I mean, Glenn, from the point of view of the Premier's comments, that's exactly it. And you'll see there will be some challenges, for example, in Western Health, where systems that had been running are now being taken offline in a planned way to do some examination. And I think Pat's comments are really bang on, that we need to do this slowly and be prepared occasionally to have to go backwards. So I think the Premier's analogy about hills is spot on. It's ups and downs.
Thank you.
We will now go to the phone. Our next questions are from Noah Shepherd with VOCM. Please go ahead.
Hi, Premier Furey. I was wondering if you would be able to provide a little bit of insight on when you were informed about the attack relative to your departure to Glasgow.
Sure. I was informed of a potential issue that was under investigation as I was actually boarding the plane. So that's the first I heard of it. But we always hear about potential issues, and certainly since that time I was updated regularly throughout the process, and was fully informed and engaged and helped directing the conversation. But that was the first I heard of it. It was Saturday midday as Minister Haggie phoned me literally as I was walking onto the plane to inform me of a potential issue that was under investigation.
As the issue developed, why didn't you feel it was appropriate to return to the province?
Well, no, I think, we've all learned that we can work remotely, and this is no different. I thought it was important to be at COP26. As the situation evolved, we looked at timelines that were applicable to my travel, and felt that we were available. We had regular updates from staff, and experts in the field about the situation. I felt fully informed, fully engaged, was engaged with the Deputy Premier, who did a brilliant job this week. Have utmost confidence in her and Minister Haggie and Minister Studley. This was an evolving situation, and we were fully part of it, fully aware of it, engaged in it, and helping direct the conversations and decisions around it. But we felt we could do that remotely early on, and as the situation evolved, it looked like the appropriate time to come home. It just happened to align with when we were coming home.
Thank you.
Our next questions are from Daryl Roberts with CBC. Please go ahead.
Hi, my question's for Mr. Diamond. You mentioned that some patients who feel that they should be compensated for travel to Eastern Health and their appointments were canceled should contact Eastern Health. Can you give some more details on who should contact and for what reason?
Daryl?
Yeah, I might ask the minister, because I know the Department of Health and Community Services have been looking at this as well, and you might have more direction, Minister.
Thanks, Dave. Yes, I didn't mean to interrupt, but we have in the department a working group with medical transportation looking at that very problem, and I would anticipate a program and an announcement in the coming days.
All right, and do we have any more, can you give any more details on the nature of this attack yet?
No, unfortunately, what we've been discussing is as far as we can go. We've been advised that any further public discourse could serve to inflame the situation and jeopardize the security of the system and the reboots as they're happening. So I know it may be frustrating for journalists and the public alike to hear that answer over and over again. It is the right one in our estimation.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hello. Has any data been breached? Has any data, public or private patient data, been lost as a result of this attack?
All that's still under investigation, Patrick.
And there's a lot of talk about chemotherapy today. Can you describe what chemotherapy, what cancer treatment actually looks like for people at the moment, given the sort of, I guess, partial, how partially things are back to the way they used to be?
Probably best for you, Dave. Yeah.
I could take that if you want.
Yeah, thank you, Minister. I'm not sure with the physicians in the room that you'd want me describing.
Well, I mean, I'm not going to get into
clinical
the
procedure.
Clinical,
but, thank you, Minister.
relevance. We have two surgeons, though, not two oncologists, so I don't think we can provide any further.
Patrick, the short answer is that the appointments are prioritized by the medical oncologist, the doctors responsible for prescribing and monitoring chemotherapy. So the order in which people have been called depends on their assessment of the clinical urgency of those cases. The process of getting chemotherapy, having your blood work drawn, having the prescription filled, as it were, in the pharmacy and made up and then administered will actually be slower, and hence the capacity of the chemotherapy clinics in any location that we've referenced will be significantly reduced. The only alteration to that is Labrador Grenfell, which are proceeding, as far as I'm aware, pretty normally, and also those two locations in the western region where chemotherapy has been unaffected already.
I'll now go back to Reach Reporter to see if you have one final question. Peter Cowan with CBC. Do you have a final question?
I do, Leslie. The reason that you've said that you were unable to give a lot of details is because you don't want to tip off the people responsible in terms of having them understand what's going on behind the scenes. But one of the key questions, of course, is who's behind this. Experts that I've talked to believe the Conti gang. This has all the marks of one of their cyber attacks. Considering the people who perpetrated this already know who they are, why can't we reveal that information?
Well, Peter, I mean, I know everybody wants details, and details will come in due time, and there'll be plenty of time for a post-mortem on all of this. But in the acuity of the situation, the information and the advice that we've been given is to have extreme caution and be extremely careful and nuanced in our communications surrounding this. And I think we have done a great job in that, and I think that's been reflected in some of the experts' opinions even. This is an active, dynamic situation, and we need to be careful and responsible in our comments and not inflame the situation. And I think that that's the line that we have to have at this point in time. There will be plenty of time to do a postmortem on this and for lessons learned. But right now, it's the most responsible thing to do not to try to inflame the situation.
Ben Cleary with NTV. Do you have a final question?
I do, thank you. How are healthcare workers doing with working within a paper-based system, and how big of a strain is it on them right now?
I can tell you from the ones that I've talked to, it's incredibly frustrating. It really slows down the operations of an emergency department. And trust me, I hear about the frustrations firsthand. It's been trying, and you're used to doing everything digital. Imagine in your own lives. If you took away your computers at NTV or CBC or wherever else and having to switch back to a paper-based system, it'd be quite difficult. And when you're talking about an operation that is complex as providing health care with providers who just want to provide care, whose hearts and souls have the patient's interest at hand, to have a system that doesn't allow them to operate the way they want, it's extremely frustrating. And I can empathize with them and really have a full understanding of where they are at, having operated in paper-based systems around the world. It's very troubling and very difficult to navigate.
Thank you.
Glenn Whiffen with the Telegram. Do you have a final question?
I do, thank you. Just wondering, do we have any idea yet of an estimate of how much this will cost us?
Not at this point, no, but I can assure you we're doing everything that we can, and fiscal restraints of solving this issue aren't a priority for us. So the top priority is making sure that this system is restored and we have confidence in the restoration so that we can provide care to the people that need it.
Thank you.
I think Noah's next.
Noah Shepherd with VOCM. Do you have a final question?
I do. Ireland, who have gone through a similar situation, they have offered their help. Are we availing of this?
We've availed of help from many different sources, including Saskatchewan, New Brunswick, PEI, the federal government, and all its agencies who are involved in cybersecurity. I'll have to confirm the exact position on the Irish government. To my knowledge, there hasn't been direct communications, but I'll certainly reach out and get a confirmation of that one way or another for you.
Premier, I would add, we have actually on the health system side had started a conversation with the Irish health system to understand how their health system was affected and whether there are lessons learned for us. And so, as you have said, on the technical side and through many aspects of this, we're availing of expertise as we can find it anywhere in the world, and Ireland is no exception. And we've had some of those conversations even this morning.
Sir, I was just referring to a government-to-government perspective.
Daryl Roberts with CBC. Do you have a final question?
I do. So we've seen chemotherapy appointments starting to resume today and into the weekend. They're continuing this weekend to try to catch up with some of the ones missed this past week. Is there a plan in place to do the same with diagnostic appointments and other things like that have been missed?
Yes, there is. The other systems that were prioritized after chemotherapy because of the pressure there include things that we've referenced earlier, such as lab, DI, and the dictation system, because that is actually electronic with voice recognition for a lot of clinicians and support services such as radiology, and the more formal back end of cardiac care. Now, it is anticipated that those wouldn't necessarily be sequential, but those could occur in parallel. But again, as Mr. Hepditch has said, the kind of plugging in elements of that would be sequenced and done in a stepwise way. So if there was a problem, we knew what the last step was we'd taken and we could reverse it.
Patrick Butler with Radio Canada. Do you have a final question?
Yes. Minister Haggie, you said earlier in the press conference that this is a process, that it will take days, that it will take time, and that time span is likely to be days. Does that indicate that you think that this will be resolved in days rather than in weeks or months, as we saw, for instance, in Ireland?
No, it means that the next steps will take days at a time, perhaps, and we've already referenced a step forward and then maybe having to take things offline again. We really don't know how long this will take until it's over, and there's always the possibility, despite the due diligence from Pat and his excellent team and the support they've had from our experts, that there may be something lurking in a corner of a machine somewhere that we is planted or is not going to be detected and may make itself manifest over time. And I think you've seen that in other jurisdictions. So again, I think we just have to be prepared to take the time, make the steps in a prudent way, and be prepared to do it slowly and right, rather than try and rush it and end up getting back to square one.
Thank you, everyone. Premier, do you have any final comments for today?
Yes, thank you all for joining. We all appreciate your patience, your understanding. No one wants to be in this situation. It feels, frankly, like a bit of a sci-fi movie. Just after finishing one sci-fi movie, we're on to a sequel. COVID, now into a cyberattack. But we have experts around the world working hard on your behalf to make sure that we, first of all, don't make the situation worse. Secondly, we make sure that we're restoring the system so it functions well, confidently, safely, securely for you. And then in time, with the benefit of time, we will have a full post-mortem and be able to look in the rearview mirror about what could be done better or how we can improve the system, all with the security of patients and the operations of a healthcare system in mind. Unfortunately, this is the reality of a digital age, and I think that you'll continue to see more and more of these into the future, and we need to be doing our best to protect against it, and we will. Thank you.